right inside here.
Right, and it costs very, very little. It's actually less than 1% operating cost for that to do. That's all you have to do. You don't have to maintain it or calibrate it. You're just changing a bullet and tube. Now, I do have both devices. I have a focus device and radial device. The only time I use a focus device is for bone work or a calcification because we know it works a little bit better for that. But both devices work. It all depends. We don't see a lot of calcific tendons in North America. No, everyone always, when we go to these meetings, well, how come? And probably has to do with water, it has to do with calcium. Not sure, but we don't see a lot of it. I'll see maybe one a month or once every 2 months in my practice. I don't know about your practice, but I don't think you see it
Not
that
a lot.
often. Mind you, there is a lot of pollution in your city, but we'll talk about that another day. That's different. Um, so, so again, so for a plantar fascia, I would do 3 treatments, 1 week apart, 2.6 bars, 11 hertz, 3 treatments, 1 week apart. Now, that's one of the protocols that's out there. There is one earlier study that was 2 weeks apart, but I think it's important to have them apart by a week. And I never go above 2.6 bars. Again, it's like your car.